So we see here three drawings of the heart. Here's the one in red and blue. Here's the one with the lungs on either side. And here's the one with the valves showing very clearly, the valves and the arteries and veins, the vasculature showing very clearly. The structures that you're going to need to know for the exam are the veins and the arteries which supply or take blood away from the heart and supply other organs like the lungs or the rest of the body, the top and the bottom of the body. And the way that you can study them, called the order of blood flow, the order of blood flow is right here. So when blood first comes into, starting with blood coming into the heart, when it first comes into the heart, it comes in through the right side. They're going to ask you to know that. It's going to come in through the right side, through the SVC, IVC. That's the superior vena cava. You see there's an SVC up here, that's superior, and there's an IVC down here, that's inferior. Inferior vena cava, superior vena cava. Those come in through, those come in to the right atrium, and they pass from the right atrium into the right ventricle through the tricuspid valve. So it's superior inferior vena cavae, right atrium, tricuspid valve, right ventricle. And then from the right ventricle, it goes through the pulmonary valve into the pulmonary artery. So through the pulmonary valve into the pulmonary artery. Guess where the pulmonary artery terminates or leads? To the pulma, which are the lungs. The lungs. So superior inferior vena cava, right atrium, letter A, shaped like this. Atrium, like the atrium of a building, is the ceiling more or less. Goes on top. It's the roof. Goes on top. A goes on top. A ventricle shaped like a V, that ventricle receives. It's on the bottom. A is on top, atrium. Ventricle, V is on the bottom. It's the it's the tricuspid valve which separates them on the right. Tricuspid on the right. Mitral or bicuspid on the left. You're just going to have to commit that to memory. Tricuspid on the right, the other one on the left, bicuspid or mitral valve. Mitral, by the way, I believe refers to the shape of the valve. Looks kind of like a religious skull cap that is worn in Islam. Don't quote me on that, but I believe that's what mitral refers to, that kind of shape. So the blood goes out the pulmonary artery. Arteries go away from the heart. Veins come toward the heart. Arteries go away. Blood goes towards the lungs, and it goes in through the pulmonary arteries, and then it goes into the lungs, and the blood is exchanged from the arteries to the veins, and the veins bring it back to the heart. The pulmonary veins bring the blood. There's a clearer picture down here. The pulmonary veins bring the blood back into the left atrium. It goes through the bicuspid valve into the left ventricle, and then it goes up into the aorta. Make sure I'm telling you correctly. Through the pulmonary veins, into the left atrium, through the mitral valve into the left ventricle. Atrium, mitral valve, bicuspid valve, left ventricle. Through the aortic valve into the aorta. These big veins and arteries, like the pulmonary artery, the aorta, their valves are easy to remember because they're named after the vessel they're going to, or that they end up going through. So the blood that goes from the aorta, the blood that goes from the left ventricle into the aorta goes through the aortic valve. The blood that goes from the right ventricle into the pulmonary artery goes through the pulmonary valve. Pulmonary artery, pulmonary valve. Aorta, aortic valve. The job of the aorta is to take oxygenated blood both up through ascending, you won't really have to know that, up to the upper body and down through the descending aorta. And then it returns to the heart through the inferior vena cava and the superior vena cava. So if you guys want to get your heart knowledge together, really all you have to do is memorize the order of the blood flow. Recall that the FSMTB was specific, that you do not need to know the structures that supply blood to the heart muscle. I need to go close the door to the room. Hold on a second. I'm sorry. Everything in New York City is small and cramped together except for the price tag. Hey, here's a tiny apartment. It's $3 grand, sucker. Okay, so the arteries and veins that supply the heart muscle, that nourish, oxygenate the heart muscle, those you don't have to know. Coronary artery, marginal artery, descending artery, circumflex artery. You don't have to know those. These are the ones where these are the ones through which a lot of myocardial infarction happens, a lot of heart attack happens, because these are the ones which get blocked through things like plaque or maybe through thrombuses, and they starve the oxygenated blood. They starve the heart muscle of oxygenated blood. So you don't have to know those. It's the order of blood flow here. Okay, now I don't usually do it this way, but I'm willing to just move on from the heart. Can I get some feedback from you guys? Do you think that you can be responsible for this information to work on it yourself? Is it okay for us to move on?
Yes.
Yes. Yes. Yes.
Yeah. Okay. Great. Awesome. Awesome. So let's take a look at some of the muscles in the body, and then we're going to look at some. We're going to do some some other stuff, like we'll do some legal or some ethics or stuff like that, because we have to get into those things.